Cassia, thank you so much for coming and talking with me. I'm super, super excited. I mean, honestly, it's been so fun having these conversations with people, and I'm so excited to talk with you, especially because you are in the UK, right?
Yeah, absolutely.
Yeah. I mean, obviously your accent. But I mean, the conversations I've had so far as part of this series have been all US based. And I've had a good number of people ask me about, residencies that are outside of the US and experiences, jobs outside of the US. So I'm super excited to talk to you about all those things and kind of talk to you about where you went to school and all those details. But just out of my own curiosity, because I'm always interested. So you are a clinical pathologist. Cassie is a clinical pathologist. And when did you decide to go into path? Like at what point did that become in your radar? When you're like, yeah.
I would like to say, I've always wanted to do pathology, but that would be a lie. So I graduated vet school in 2014. I worked in practice for 1 year, and then I did a rotating internship at the University of Cambridge, which is also where I studied.
Okay.
To be honest, I kind of went into that internship thinking that I probably wanted to specialize because I am quite a detail-focused person, and I like to do things in a very logical way and feel that I am doing the absolute best job of whatever it is that I'm trying to do anyway. But to be honest, at that point, I was very interested in medicine, in neurology, and I also liked ClinPath. But I think it was during the course of that internship, really, you kind of work through a number of different disciplines, working with specialists in different fields, and I realized that the thing that I really like is the workup. I like the kind of logical approach and the sort of challenge of what is the problem with that animal. And for me, ClinPath was the thing that allowed me to really to do that.
Yeah. I always say I'm so interested in everything up until diagnosis, and then as soon as we hit the diagnosis, I'm like, of course I want the animal to do well, but I don't want to be the one to have anything to do with that.
Or someone starts saying surgery and you're like, la la la.
Right. Yeah, I was kind of pushed pretty hard into spaying a cat during my internship, and I think they did it just because they knew I really didn't want to. And I'd done one dog spay in vet school, but when I got into that cat spay, I mean, it was a healthy young cat spay, and it took me like almost 2 hours because I just couldn't handle it. So I totally get you on that. And so you did your internship. So you did 4 years of vet school. And
did you say in the UK it's 5 or 6 years? You have a slightly different structure. So I think you have to do a degree already before you go to vet school. Is that right? Whereas for us, veterinary is what you choose from the point of being 18. So when you graduate from what we call college is sixth form college, until age 18. So you then choose to do a veterinary degree, which depending on where you go in the UK, it's either 5 or 6 years. So I went to Cambridge and it's 6 years there because we do like an extra year in the middle where you get to choose like a different subject to do for a year. So believe it or not, I did history and philosophy of science in my 3rd year.
Oh, that's cool. That's really cool. So that whole 3rd year, you're working on that.
Yeah.
Oh, neat.
It sounds totally unrelated, and I think they have changed it a little bit how they do it now, so that you can't do like a completely out there subject. But I actually found it super helpful because like the veterinary course, particularly in the UK, it's very fact learning. You don't really think a whole lot about your opinion about something. It's just learn a list of facts about X, Y, and Z. Whereas actually I found that quite useful because it forces you to have an opinion about something and make an argument. And
that's so interesting. Have you are you a big reader? Do you like not textbooks? Obviously we're all big textbook readers, but have you read Bill Bryson's book Body?
No, I haven't, but maybe
you should. So first of all, he's a travel writer. This is a little tangent, but he's a travel writer, and he has just amazing, like funny, insightful memoirs about his travels. I'm pretty sure he's from the UK, if I remember right. And he wrote his most recent book is called Body, and it is so interesting because he's not a scientist, but he is clearly an extensive researcher, and he writes all about like the human body, but the history, sort of the history and history of science behind a lot of the discoveries and stuff that we've made about human medicine. So it's really interesting. It sounds right up your alley, but that's so cool. And I love that. I love when people have different things that they've done, you know, that have been a little bit of kind of like not, I guess it's kind of a peculiarity, but it's still tied in. So yeah, that's very cool. And so then you went into vet school. So you did that. So you guys have to do sort of as a combination, and then you are in vet school, and then you're doing your vet school studies in years 4.
Yeah, it's kind of, so it's a bit different depending on which vet school you go to. They're all slightly different, but generally speaking, the first 2 or 3 years is like preclinical, mostly theoretical kind of physiology, this sort of thing. And then the last 3 years tend to be the more, more practical.
Gotcha.
So in Cambridge Vet School, the last year is entirely on rotation, so there's no lecturing. It's all
okay.
Yeah.
So that's like our clinic, what we call clinics or rotations or whatever. Okay. And then did you say you practiced for a year and then went into residency?
Yeah, so I practiced for a year just in a small animal practice, and then I did my internship after that, and then my residency.
Okay. So you did practice and an internship and then residency. Yeah. Okay. So you needed a little bit more time to be 100% sure that you were going into, but that sounds like that clinical year really solidified it.
A lot of the residencies in the UK, obviously they're European residencies rather than doing American boards, and it's a requirement for the European colleges to have either 2 years in practice or an internship. And it's very competitive here now in many places to get an internship. So it's now quite uncommon for somebody to come straight out of vet school and go directly into an internship in the UK.
Interesting. I think it's sort of moving, well, I don't want to say it's moving in that direction because there's still plenty. I mean, I would probably venture to say most, I don't know, I'm not an academic, so I don't want to speak out of turn, but you definitely can get a residency without an internship still, but there are a lot more applicants who have internships. And so I think that kind of factors into that. There's still not, most are not, I think there is one that requires an internship, but most do not require it, but it kind of is a sort of like unofficial requirement in some cases, depending on your applicant pool. So how did you feel during your internship? I mean, you said that kind of solidified it because you went to, like, you liked the workup, but like, how did, I know this isn't ClinPath related, but I'm just curious, did you enjoy your internship? And not a knock on your internship or one way or the other, but how did you feel about it?
I think, to be honest, at the time, I'm not sure that I could say I really enjoyed it. Because obviously, you do night shifts, you do long hours, this kind of thing. But I think it was really helpful to me because, to be honest, I wasn't the most confident vet going into the internship particularly. And it just gave me that reminder of kind of approaching things in a level-headed way, particularly animals that are in critical care, this kind of thing. Just asking yourself, okay, animal is tachycardic, what's the blood pressure, what should I do I try and give a fluid bolus, like this kind of thing, which it sounds like if everyone should know that coming out of vet school, but I think I just panicked a bit when I went into practice and I just lost that kind of logical approach, and the internship helped me to get that back, I think.
No, I think that's totally, and I love when people say that out loud, because I think that it's easy to see where we're at farther down in our career, and especially younger veterinarians or vet students that are, I don't know, there's just this impression, I think, that you're supposed to have your shit together when you get out and know what you're doing, and at least that's how you feel, even if you have good mentors or whatever. And I felt the same way. And going into my internship, I had a really hard time because I really lacked that confidence. I felt really out of place. It didn't help that I wasn't super interested in the treatment side of things, but I ultimately was glad I did it. And I think it sounds like you are too, but it was good to have that experience. And two is, there were parts of my internship that I feel like, and I definitely want to preface by saying, I don't think you have to have clinical experience or do an internship to be a good clinical pathologist at all. I know many that are great, and I'm sure you do too, that don't have that experience. For my own self, there were pieces that I really felt that I was happy to have had that experience, you know, because of how I was able to relate to the veterinarian on the other side of things. And I mean, do you feel the same way about yours and where you're at now?
Yeah, absolutely. I think it particularly, I guess it depends a lot where you end up working as a clinical pathologist as well, and whether your caseload is kind of primarily referral or whether it's first opinion or a bit of both. But I think having already worked for a year in first opinion and having kind of some experience of what things were common there, it really helped me to understand what would be the common things that you see at a referral centre. And I think it just gets you a bit more into the mindset of the clinician that you're dealing with at the other end of the phone or the computer or whatever. You know, you kind of understand what their approach to the case is, and maybe a bit, I think for me anyway, that enables me a bit better to understand what they want from me as a pathologist. So I found it really helpful from that perspective.
Yeah, that's a huge perspective, because even it's kind of an unspoken, or it's like hard to learn necessarily unless you've, again, I'm careful because I don't want it to sound like you can't have this if you don't have that experience, but it just, it creates this mental connection, I guess. Like, I know that they need this information because this is probably what they're asking themselves or what their owner's asking of them. So yeah, that's very cool.
We know that they don't always tell us that on the form, so
right.
it's quite useful to have that background.
Right, exactly. You can kind of fill in some of those gaps that might be left out. Okay, and so then you went into your residency, and how do the European residencies hang together? I'm not sure how they're different from ours.
So I think overall it's very similar, and I did visit a couple of places in the US as well while I was a resident. I think that actually that's one of the major differences, is that the residencies that are sort of approved by the European College, there is this requirement to do 4 weeks of externships per year, which that can include conferences, and it can include going to summer schools and this, that, and the other. It doesn't have to be going somewhere far away. But actually, I think that was one of the things I really valued about my residency, was that there was this need to go to other places and see what other people are doing. It meant I got to know a lot of other people. I got to know other residents, which is really valuable, and that I really liked. Other than that, I think it's very similar, particularly in the way that it's structured anyway, to the residencies in the US. You know, you have a supervisor who oversees you, looking at cases and this sort of thing, and then it's just a different exam at the end of it. Although I was quite fortunate in that I also received some kind of co-supervision from an American diplomat while I was doing my residency, which is why I'm going to sit the American board exam.
Oh, nice. Wow, that's a big doing both. That's a why yeah, why do both? I'm just curious, like, what's the benefit of having both?
So to be honest, between you and I and whoever's watching this,
well, everybody watching,
I probably will just do the American.
Oh, okay. Okay.
It's just that I did the residency supervised also by European diplomats, and that the European College is a little different in that they accredit the training program, as well as I don't know whether that's maybe the same for the ACVP or not, but the program itself and the lab has to be accredited, so in order to be eligible to be a European residency. Okay. So having done that and having fulfilled my credentials for that, I would be eligible hopefully to sit the European exam, but because of timings and because of the way things went for me, I had chosen to try the American instead.
Okay. Yeah, it's I feel like all the different accreditation stuff and just the way that all of that hangs together could be really confusing. But
yeah, I think on the whole, to be honest, I think there's not really much in the way of differences between the European and the American residencies, at least that I've been able to see.
So they're in general 3 years.
Yeah.
Okay. And do you guys have what's the word I'm looking for, like master's or PhD degrees that people do in conjunction?
Not
the way
usually.
Okay.
It's usually just a residency.
Just residency. Okay. Yeah, because a lot of the, and as I'm sure you know, a lot of the American residencies are combination programs, and a good number of them like require a PhD combination, but there are some that are flexible and either don't require. I think most of them at least require a master's, but you can do at least for mine, I did a master's combination, but it was a non-thesis master's. So it's not that it was easy. It wasn't. I had to do a project that resulted in a publication at the end, which we're still working on. But you know, there was that project piece of it and the publication, but not the thesis part. So it was a little less intense, I guess, in that way, but there were still the course requirements as part of it. But I was still, you know, key being I was still able to get it done in that 3 years. I just didn't have, you know, I didn't have big aspirations for research and didn't feel like I would probably end up at academia, and had friends that had gone through a PhD and know how rigorous and hard it is. So I was like, I just don't know that I have a career goal that will necessitate that. So I specifically looked for residencies that had that flexibility, and then chose that master's program. So I was able to get that done in 3 years. So, but yeah, a lot of them are kind of,
No,
I don't want to say pushing PhD, but a lot of people do. Yeah.
As far as I'm aware, and I could be wrong, I'm not aware of any UK-based residencies that offer a combined PhD.
That they even offer.
Yeah, that there is at least one place that offers that requires you to do a master's as part of the training, but I'm only aware of that one. I think most places you're a resident and that's all you're doing. Yeah.
Interesting. Okay. Well, I mean, that's not that's not small potatoes. The residencies,
Yeah.
you know.
Yeah.
Oh, you're just doing a residency.
Yeah.
But speaking of that, so how was your like how? I mean, so we talked about the European, like American kind of differences, but yours. I mean, how did your some questions I get a lot is how, what's kind of like the day-to-day life of your residency, and you know, where did you like study, like not literally where, but like at what, like how is your day structured basically, which I know can really vary from year to year, but.
So I guess, so because I did my residency in Cambridge, it's an academic institution, and to be honest, the caseload is not super high. Most of the cases that we're getting in clinical pathology are coming from the hospital, and the amount of external work is quite limited. So it gives you plenty of opportunity most of the time. I mean, obviously we always have busy days, to kind of study around cases and to discuss things with your co-resident or with your supervisor or with other clinicians who are on the case. And I think that one of the things that I valued most about my residency was that because Cambridge is quite small, the clinical pathology is really part of the team of the hospital. So my day would be in the morning, I'd come in, we join medicine rounds with the internal medicine clinicians. They discuss the cases, and of course we also have students as well. So the students often will do like a presentation on their case. We discuss differentials. If there is anything kind of relating to the clin path of that case, then the resident usually will kind of discuss that and maybe ask the student a few questions about it, that kind of thing. So that's the start of the day, which I really like, because it means, you know, we know you kind of feel like familiar with the cases that are in the hospital. You know what investigations are planned for that day, and then that is really nice when you're then looking at the clin path samples from those patients. And then it's kind of a mixture of obviously reporting, hematology, biochemistry. We do interpret all of those as a resident, because I think mostly as a practice exercise for the resident in ClinPath. And also it's helpful for the students as well to be able to read the interpretation of their blood results. And then cytology wise, I guess, you know, it was a case of kind of looking at the slides myself as the resident, and then feeding back my thoughts to my supervisor, discussing it together, writing the report, and then going from there, I guess.
Did they have you looking at cytology from the beginning of your residency, or yeah, okay. And did they kind of let you stepwise take more of a lead on that as you moved along?
Yeah, absolutely. So by the time I was in my third year, I was pretty much more or less, I guess, self-sufficient in terms of cytology reporting. And I also, during my third year, started also doing some work for a private lab, doing some Saturdays for them, which I found really kind of boosted my confidence a bit, I suppose, because, you know, when you're a resident and there's somebody else there that you can fall back on if you need to, then there's always that temptation to fall back on them when you don't necessarily maybe need to. Whereas, you know, when you're kind of thrown in the deep end, as it were, and you're on your own, and it forces you to make a decision, to have an opinion, and to
and that's terrifying. I mean, that's terrifying as a veterinarian practicing, as a pathologist. I mean, we all experience it because, again, being a specialist, it doesn't matter, you know, if you, anytime it's new, you know, especially right out of your residency, and you're just sort of like, okay, now I'm flying out of the nest and have to really take what I've learned and trust myself. And I don't know about you, but I feel like I experienced that, the name is escaping me, that curve where it's like, you know what I'm talking about, where it's I know, you know, I think I know more than I actually know. And then you get more confident, and then you get knocked down and you think, oh, okay, wow, there's actually a lot more behind this door. And then you sort of get more comfortable with more experience and more time that you're comfortable with what you don't know, you know. And I feel like it was some experience that that's how I feel like you truly have sort of settled nicely into, you know, a confidence or a stride there, is where you go, you know, I don't know what this is, and maybe it's because I've never seen it before or whatever, but I'm okay to say that, because I don't know, you know, that we can tell what that is, you know, here's the extra steps we have to take to know.
I think that's something that I did not really get when I was a resident, in a way. You know, when you're a resident, if you don't know, and if nobody that's around you knows, you think, oh, it must just be because I'm really rubbish. Like, we don't know. But then, you know, you speak to more people, you see more stuff, and as you said, you kind of become more confident in yourself to just say, you know what, I don't know. So, you know,
and I'm okay with that.
It's a bit weird. This is my process, but I don't know.
And it's just like you said, just being able to say, this is a weird one, and know that it's not because you're just the dumbest person on the planet. It's because it's a weird one. It's because it's not an easy one, and you've seen enough, or you've experienced enough, that you can say that. So you know, we're always all still learning, and nobody should get overconfident, but to even be able to admit and feel comfortable in the I don't know is really I think a good place to be. But
well, when I first started reporting things on my own, particularly when I was working privately, I would go home at the end of the day, having reported I don't know how many cytos, and just be absolutely terrified for the rest of the weekend that I'd done something wrong, that I'd made a mistake, people were going to think I was stupid, or like an animal's going to have a bad outcome because I did something wrong. And I'd be just waiting for that Monday to come and to get like a phone call from someone that's come in being like, what were you talking about?
Or the opening the email on Monday, that always bothered me. I hated that, opening the email on Monday.
And sometimes, so we, you know, obviously it's really nice when you get like anatomic path feedback on cytology cases that you've looked at, and the place where I was very good at providing that. So sometimes you get an email through that was just like, you know, great job, here's the histopath report on the thing that you'd looked at, and until you've opened it, you're like, oh my god, I must have done it wrong. This is why they sent it to me.
That's so funny, because when I worked at a diagnostic lab, I would get an automatic email anytime the vet submitted histopath on that case, and so it would come back, you know, like a couple days later or a week later, and it would always, you know, when I was working in this lab, I read like 60 cases a day, so I would sometimes get, you know, multiple of these follow-up histopath emails at the in one day, and I had the same feeling. Like, I would be like, oh, there they are, oh no, but I always forced myself to open them for two reasons. One, because it's such an incredible way to learn, like to know, you know, what they saw, to correlate that with what you said. And then also because I don't know about you, but the vast majority of the time, and I think probably most of us can say this, that we were probably right or on the right track, you know, and if we were off a little bit, it was probably because, you know, we didn't just make some gross mistake. It was just, you know, there were, you know, it was such a nice way to sort of just shift, you know, and say, I've seen one that I called this, but it ended up being this. And then, you know, that's such a valuable. I'm so glad that they gave you guys that feedback in residency too.
It's really helpful.
Well, And so what did you, so you went through your residency and did you start to get a feeling for what you wanted to do like after residency early on or later on, or how did you decide what to do and what are you doing?
So I think I don't know if you would agree, but I think that most people who have done a residency, even though, don't get me wrong, overall looking back at it now, I loved my residency. I made some great friends, like I had a great time and it was a very good 3 years. But at the time I was getting to the end of it and I had enough, I just wanted to get out of there.
Yeah.
So I felt like I needed to leave to go somewhere else to get some more experience, go somewhere that was a bit more busy with a higher caseload. I warned you that my cat was going to appear. Here he is.
Oh, oh wow,
Bruno.
he's really
Yeah.
long.
Yeah.
Hey, buddy. I don't think anybody will mind seeing him. Hey, Bruno.
He's 23 years old, believe it or not.
Are you serious? Wow. And you've had him since he was a kitten?
No, I adopted him from the Blue Cross Cambridge at the age of 20.
Oh my goodness.
Yeah.
Living out his best life.
Yeah.
Oh my gosh. I can't believe he's that old. He doesn't look that old. Wow.
So yeah, I felt like I needed to go out. I needed to do something a bit different. So and I wanted to, having trained in a kind of academic environment, I wanted to experience what it would be like to work in a private lab. So I went to work at VPG Hitchin, which is it's kind of like a group of private labs in the UK, which is owned by SimLab. And they are located on the same site as a pretty big referral centre. So although they're not part of the referral centre, they're still on site with other specialist clinicians, which is something I really liked. I really like having that kind of interaction with the clinician, whether that's a specialist or whether that's a first opinion vet who submitted samples. And that was something that they put a lot of emphasis on there. So kind of, having that kind of dialogue with your clients, which I think is really nice. So I worked there for a year and a half after I finished my residency. Obviously the boards got cancelled last year because of COVID.
Yeah.
So, what can you do?
Yeah.
And then ultimately, I now am back at the vet school in Cambridge as a clinician in clinical pathology there. The reason being that I just really like the variety of that job. It's the same, I get in the morning, I go to medicine rounds, I'm part of the team in the hospital, or at least I feel like I am. Mm. And, there's teaching, there's students, there's residents to teach. We get a good variety of cases. Like, it just is somewhere that I really like. So yeah, that's why I'm there now.
Good. No, that's good. And it sounds like, based on the way that you described your early interest being in internal medicine and ClinPath, you've got that interest in that side of the specialty world that's not necessarily ClinPath, but they meld so well together. And I totally agree. Like I felt the same way as far as when I went out after residency and started working. I was working for a lab, but I really wanted to be in that interaction with other clinicians. I know I'm a pathologist, but I actually like being around people and talking, to them about their cases. And yeah. The stereotype is not always true, but just being able to have that, like, to feel like you're a part of a team and really helping, and there's so much information that comes out of those conversations sometimes, just even whether it's by phone or even better in person. So I was inside of a specialty hospital working for the lab, and my husband's an emergency vet, so we actually worked together. And so I had that similar experience, even though it wasn't an academic institution. Just being able to be, you've got a question about a case, or you're like, oh, this is a weird one. Let's go down and talk to so and so about what's going on. And even getting to see the patient's pretty cool, even though you're not going to do anything to it. But I totally commiserate with that. And that's such a valuable thing for people who want that kind of interaction. And so how long have you been back at Cambridge?
I started back in March, so only a couple of months.
Okay. Well, congrats. That's a big move, but I'm glad to hear that you're comfortable and happy there so far. And it's nice kind of coming home and, being able to be part of teams that you probably already know people there, and
Yeah.
very cool. Well, and what a little bit of a shift, but I always like to ask, I've been asking people, so what kinds of do you have areas of interest, like are there things that just get you really excited to see, or in particular, big categories, small categories, specific cases, anything like that?
So I guess big category wise, I guess a lot of clinical pathologists are always going to say cytology.
Not
Just
all of
that.
them though. Not
Um,
everybody's jam.
Not necessarily a specific thing, but sometimes you just see something, even you're looking on low power on the microscope, and you're like, oh, that's so cool. Like,
Yeah,
or you
yeah,
when you like already look at it and you're like, oh, I know what that is. And like,
yeah. And then you impress all your friends because all the students are like, how did you see that from that far back? I remember being a resident and asking my mentor, how could you tell that was lymphoma? We're just still on 10x, and
yeah,
she's like, you'll get there. It comes.
there's something super satisfying about that as well, isn't
Yeah.
it? Or like, that's I really like that. And then just I think like you see certain things on cytology that you're just like, oh, that's really pretty, or like a cool plasma cell tumor that's got some like flame cells, that kind of thing, like
Yeah.
just looks nice. And then of course the thing that always looks very cool but is always very bad for the poor animal is like, oh my god, look at that cell, it's like, and
Yeah.
oh my god, it's the Death Star. That's
Yeah, you can see it without even looking under the microscope, kind of thing. Yeah, the gigantic cancer cells. And it's funny because you and I both experience this, all pathologists experience this, that the things we get really excited about and we're going, hey, come look at this is so cool. And then we have to be conscientious when the clinicians come in, because they're the ones actually involved with the clients and with the patient themselves, and we're all like high-fiving each other, like, look at this.
Contain your inner nerd, like look like a normal person for this conversation.
Right. Or at least read the crowd, because if they're okay with it, because of course we're never being like insensitive towards the patient. I don't know about you, but I always try to not read the patient's name, just because once I read the name, I feel like I can, not that they're not an animal before I read the name, but like that just, I'm like, oh no, it's things like Bozo, and it probably has a little kid. Yeah. But I love it, because that's just how like you really are in the, or it's one of the ways I guess you're really in the right profession, when you just get so excited about what you're seeing, and I can totally relate. And so I totally agree. Flame cells and just some of the big cancer cells are so fun, and infectious stuff, which you guys, I love infectious stuff because
we don't
we
get
have
much.
a lot here. You don't. I know.
No, we don't get very much. I mean, unless we're seeing more and more imported animals now in the UK from other countries, usually in Europe. So we see a bit more, leishmania, this kind of thing. But fungal disease, yeasts, that's very rare here. So
that's so interesting. I mean, obviously good for the animals there, but I live in the southern United States, and it's just everywhere here. I mean, we've just got fungus everywhere, which is really fun as a clinical pathologist, but tricky for when my husband and I are sitting down for dinner and he's talking about his patient that has blasto, and I'm excited because we found it in a weird place or whatever, and he's like the one trying to treat it. It's kind of a funny conversation, but it's interesting, the difference. And one of the cool things about all the social media and just like being connected in these ways is being able to see what other people have, because I've never had a case of leishmania, and in other places people have it every day, and just being able to see those infectious things and share those is really neat part of that. We've only got a few more minutes, but I'm curious if there's any this has all been really great, especially knowing what similarities there are between the UK or the European residencies. I don't know why I just assumed they were very different in the way that they were structured, and it sounds like the biggest difference that between like what we both went through is just mostly on the front end, like the vet school experience is different, but the residencies and kind of internship experience is very similar. But for people that, I think there are a lot of pathologists that have practiced for some period of time before going into residency, whether it be a year, kind of internships even aside, but going and being in GP or first opinion practice and for some period of time, and then going, you know, I've always been interested in pathology. Now, I think all of us would say, don't go to pathology just because you're burnt out in GP, because clinical pathology is really cool, and anatomic too, but it's not something that you can kind of just will yourself into loving just because you want to do something different. But for people who have said, you know, I've been in some other area of vet medicine for a while, and I'm really interested in clinical pathology, and I think that I'd like to go back, but I don't really know. And I know you had just a short time practicing, but you did practice. So what kinds of like advice would you have for somebody who is thinking of doing that, of making that transition and trying to apply for residency? Do you have anything you tell them?
I think just talk to people is one. You know, keep an eye out for what residencies and things are coming available. Obviously, at the moment, coronavirus is making things a bit difficult, but I think you'll find that a lot of places are really happy to have people come and visit, just to, you know, get a bit of experience, see what it's like to work in ClinPath. So I think, you know, visiting a few different places, if that's possible to do, is a really beneficial thing, and just showing that you're interested. People remember that, you know, we have people come and visit, and just, you don't have to, it's not like, I don't know whether it's the same for other specialties, but I think in clinical pathology, for me anyway, I wouldn't expect someone applying for ClinPath to be an expert at cytology, or to really actually have any great, sorry, that's my cat, any sort of really in-depth knowledge of ClinPath. I think it's just about being enthusiastic and being interested and being willing to learn. And I think that's what you remember about people who apply for residencies or who come visit you or whatever else. You know, you're not going to be expected to turn up on the first day and be able to diagnose some complicated thing on cyto.
Yeah, that's what I remember the relief I felt. It was probably my first week of my residency. My mentor said, I don't expect you, like, I want to get this out of the way. I don't expect you to know anything really about what we're doing. That's the point of your residency. I'm going to teach you all this stuff. And I just thought, okay, you know, it's okay. That's space. That's a good mentor and a good teacher there, but just that space to just learn and give it, you know, and they knew I wanted to learn. So it's just like you said, like, as long as you're willing and receptive to learning, you don't really have to come in with that. Yeah, definitely.
And I think actually it's more common than people think that that people that end up doing a pathology residency have had that experience in practice. And like one of my very, very good friends who I did my residency with, she worked in practice in Italy for, you know, for many, many years before she decided she wanted to do ClinPath. And actually being an experienced clinician and having that knowledge, you know, that's really valuable. So I don't think people should be put off because they didn't go straight into it, or they didn't do an internship, or whatever their situation is. I think just having a go in practice can be really valuable as well. You know, if you're going to take a cyto sample, have a look at it yourself, maybe stain a slide, see what you think, get a nice textbook, and you know, maybe even have a go yourself at kind of, I think that the thing that I didn't get so much before my residency was trying, you know, you look at something, whether that's a set of bloods or whether that's a slide or whatever, and you just see everything all at once and you think, I don't know what that is. But maybe trying to practice that kind of logical approach to looking at a set of bloods or a cytology slide, maybe write a few things down, and then when you get your report back from the lab, you can compare, and that's a great learning tool. But yeah, I think there's I think clinical pathology is actually a really accessible specialism, and people come from all kinds of different backgrounds, large animal, small animal, people that have been out of practice even,
other specialties
or not, like, yeah, absolutely. And yeah, just if it's something you're interested in, have a chat to people and you know, see where it goes.
Yeah, and I think what you said, I mean, all of those are I would say the same thing. And the first one you started with is the same one I would start with, which is just making connections with people and visiting. You know, it's if you can visit. Again, 2020 was a weird year, but we're hopefully moving forward. I know not every country's in the same place with that, but hopefully it's behind all of us soon. And visiting is going to be possible again. But even in that period of time, some schools I'm sure have gotten creative about, virtual visits and whatnot. And you have to ask, like, you just have to find a contact information, even go find something online. And if you're really serious, make sure that you thought through it and you really are interested in because we don't want to waste anybody's time, of course. But if you're really seriously interested and you want to know more, people, just like you said, every time I've ever when I was in my residency, anytime anybody was interested to come GP or otherwise and just kind of hang out with us for the day, just to sort of see what we did. And that's beneficial on the program's part too, because they get to meet the person that's interested and they get to see how they would work together, because 3 years is a long time and you want to make sure that you jive well with somebody. So that, I think that connection and that knowing that person, even after a day or even after an hour, anything is so valuable. And that networking is just really, it's cliche, but it's so important. So I think that's a really good point for people to understand.
And I think if you apply for a residency and you don't get it, then most of the time people who read your application or who interviewed you will be very happy to give you some constructive points as to what you could work on or what might make you a more attractive applicant for next time. And also I think perseverance is a good thing. You see somebody that applied last year and they didn't quite get it, and then they apply again the next year, then that shows that they're dedicated.
Yeah. And all of us, I've applied to a couple different residencies right off the bat. There was one in particular that I really, really wanted, and I didn't get it. And the program said you were right neck and neck with the other person. They had just had an internship, and they were looking for somebody with internship experience at the time. So I was really bummed, but I didn't really know exactly what to do. I did my internship. That was not necessarily like a backup plan or anything. I just thought it through and was like, okay, I'll do an internship. I applied the next year and I got that residency. And so I was just, and the person that got the residency that I didn't get the first year became a great friend of mine. She was my, second year resident, and it all worked out, and it's not that anything's wrong with you. It's just sometimes there's a really strong applicant pool and you just have to, there's only so many residencies, and you just have to keep trying if you really want it. So that's so true. I have to ask, you have a music stand behind you. What music do you do? Is that a keyboard behind you too?
Yeah, so it's a piano. So I play the violin. That was
wow.
I played the violin for a long time when I was younger. It's now kind of mostly ornamental because I hardly ever play it.
Wow.
But that and of course, like during the first lockdown, everybody bought a ukulele, myself included. So, have a go as well.
Yeah. I feel like we should have thought, if I could go back again and buy stock in some really strange things before 2020, like ukuleles or RVs or whatever, just the things that got really popular. So you do music as a hobby, and do you do anything else? What else do you do?
I like kind of walking, cycling, that kind of thing. I used to, when I was younger, do a lot of water sports. So I used to do a lot of wakeboarding.
Oh, wow. Okay.
I used to work at a wakeboard school, believe it or not, for my teenage years. But,
wow, how funny. That's so cool. That takes so much strength. I've tried to do water sports and I'm like, I'd rather just sit on the boat and have a margarita and watch everybody else. But
that's where I've got to these days, I think.
Okay,
my hobby
is
watching Netflix in the bath.
Hey, there's nothing wrong with that. The older you get, the more you appreciate a good book and just like the quietness of your home. So yeah. No, that's cool though, that you still find joy in the things that you have, even if your music stand's ornamental, it's still there and reminding you of all the, other good things outside of work and all those things. So well, cool. Well, we're wrapping up here, and I really so much appreciate this. This has been really great talking to you and meeting you. You and I haven't met before, and just making those, it's really neat to talk to other pathologists and other people in vet med in general, but just people that have that same passion. And it's really cool too that we're just on different, in different areas of the world and can connect like this. So
Yeah.
maybe we'll actually meet in person at a conference one day, one day soon when they're back in person. I know we're getting there, but but yeah, thank you so much. I know this is going to be super, super valuable for everybody that watches, and it, I will be posting it to YouTube. So if there's any questions for for you in particular, people will post it under there. Or if you are comfortable with me sharing any of your contact info anywhere, then I can add that to it. Just if
no problem. Yeah, I'm always happy to chat to people.
Awesome. Yeah. Well, nobody contact her unless you really want to chat. Don't be like, just blowing up her inbox. But yeah, it sounds like she's available for questions about any of this stuff. And you've been super valuable and helpful for everybody. I know that they'll love it. So thank you so much for doing this and for chatting with me. And it was really great to meet you.
You too.